Good morning, Alex and friends. I'm Grace. Today is Thursday, July 30th, 2026, and you're listening to Alex's News. We are looking at a hot one in Riverside today, with a high of 97.3 degrees and a low of 66.7. So please make sure to find some shade and keep hydrated if you are heading out. Coming up, we are examining how a significant expansion of opioid treatment programs in Kentucky unfortunately paved the way for systemic fraud. We will also look into the controversy surrounding Kaiser Permanente and a formal complaint filed regarding the use of their mental health algorithms. Along with these reports, we have a variety of other headlines to catch you up on the day's most important news. All of this and more on today's edition of Alex's News. Stay tuned. Good morning, everyone. We're starting today with a deep look at Kentucky's fight against the opioid crisis and how a well-meaning policy may have opened the door to widespread fraud. Our reporter Ethan has been following this story closely. Ethan, good morning. Where does this all begin?
Morning, Grace. It really starts back in 2020, during the height of the pandemic. Governor Andy Beshear was facing two crises at once, COVID-19 and soaring drug overdose rates. So he loosened Medicaid spending controls, joining more than 40 states that lifted certain restrictions. The fear was that patients would simply avoid treatment if the process was too hard.
So what exactly did loosening those controls mean for treatment centers?
The big change was that recovery centers could provide expensive treatment without first getting prior approval. Normally, they'd have to prove what's called medical necessity to state Medicaid insurers before billing. That step was gone. It made sense as an emergency measure, but here's the key detail. Most other states reinstated those prior approval requirements by 2023. Kentucky kept the looser rules in place.
And that decision had a big effect on treatment capacity, right?
A huge one. By 2023, Kentucky offered over 1,100 spots for long-term treatment. That was a state record. And it gave Kentucky the highest number of slots per capita anywhere in the United States. On paper, that looked like a real success story. The state was suddenly a national leader in access to care.
That sounds like exactly what they wanted. So where does the money problem come in?
The spending climbed dramatically. Kentucky Medicaid Commissioner Lisa Lee told a February 2025 meeting, so about a year and a half ago, that spending on behavioral health and addiction treatment had reached $2.3 billion in the previous year. That's an enormous figure, and it drew sharp criticism from people inside the industry who felt the system was being taken advantage of.
Who was raising those concerns?
One of the loudest was Stuart Owen, who represents a Kentucky Medicaid insurer. He told a state advisory committee that the system was being exploited by, quote, unscrupulous providers, end quote, for profit. And he wasn't alone. Throughout 2024 and 2025, the Beshear administration received a whole series of warnings about the lack of oversight. It wasn't just one letter or one meeting.
Walk us through some of those warnings.
Sure. In August 2024, the Kentucky Association of Health Plans sent a letter saying weak oversight led to, quote, unnecessary, end quote, spending. That was money going to services that lacked evidence-based support, or weren't even provided by licensed doctors or therapists. Then in late 2024, insurers WellCare and Anthem held meetings to express their concerns directly.
And I understand a local mayor got involved too?
That's right. In late 2024, Somerset Mayor Alan Keck wrote a letter asking the state to reinstate spending controls. He alleged that some companies were fraudulently recruiting out-of-state patients and misrepresenting the services they provided. Then, more recently, in December 2025, the Kentucky Attorney General's office officially identified Medicaid fraud in drug treatment as a primary, quote, area of concern, end quote. So the alarms kept getting louder.
Were there specific services where the spending really jumped?
Yes, and this is striking. The data showed a massive spike in what are called lower-level services. payments for peer support services totaled over $147 million across 2023 and 2024. And payments for something called psychoeducation skyrocketed, going from $40.4 million to more than $168 million in that same window. That's a fourfold increase in a very short time.
Those are staggering numbers. Was there one company at the center of all this?
There was. The most prominent example is addiction recovery care, known as ARC. It was the state's largest provider and the biggest recipient of state funds between 2019 and 2025. A joint investigation by the Lexington Herald-Leader and ProPublica reported that ARC exploited the lack of spending controls and may have falsified billing. At one point, ARC was treating roughly 1/3 of all Kentuckians seeking drug treatment.
1/3 of everyone in the state. So what's happened to ARC since?
The fallout has been severe. The Department of Justice reached a $16 million settlement with ARC, though Louisville Public Media reports the figure is $16.2 million. That resolved whistleblower allegations from 3 former employees. They claimed the company directed staff to falsely bill Medicaid for services like peer support, the same category that saw those big spikes.
And there were criminal charges as well?
Yes, in June 2026, so just last month, the DOJ indicted RC's leader, Tim Robinson, for wire fraud and money laundering. That was tied to a separate scheme to defraud lenders. Robinson has pleaded not guilty, so that case is still ahead of us. But the company itself has essentially collapsed under all of this.
How bad is that collapse for people who need treatment?
It's significant, and this is the human cost. ARC has been forced to close most of its facilities over the last 2 years. Because it was so large, that closure caused a staggering 56% decrease in long-term residential treatment beds across the entire state. So a policy meant to expand access has, in this corner, dramatically shrunk it. Patients who relied on those beds are now scrambling.
How is Governor Beshear responding to all of this?
He's consistently defended the spending. In a June interview with ProPublica and the Lexington Herald-Leader, so again just last month, he pointed to 4 consecutive years of declining overdose deaths. To him, that's proof that removing the medical necessity barrier was the right call. His argument is essentially that access saves lives, even if some money was misused.
Do experts agree with that reasoning?
Many push back. They note that neighboring states like Tennessee and West Virginia saw similar decreases in overdose deaths without loosening their Medicaid billing rules. So the drop may not be tied to Kentucky's specific policy. Academic studies suggest the national decline is actually due to an increase in naloxone use, declining opioid prescriptions, and less fentanyl in the drug supply.
That disagreement seems to have spilled into the State House.
It did, in a big way. In 2025, Republicans passed a bill requiring treatment centers to seek insurer approval before providing services. That same bill also stripped the governor of the power to change Medicaid rules without legislative permission. Beshear vetoed it, but the legislature overrode his veto. So the loosened rules he championed have now been rolled back over his objection.
So where do things stand right now?
The administration says it's been working to fix the problem. Spokesperson Scotty Ellis said a November 2024 letter clarifying billing practices led to a decline in billing of over $100 million between 2025 and 2026. So they argue the tide is turning. But there's a complicating detail from the other side.
What's that detail?
The Attorney General's Office of Medicaid Fraud and Abuse Control warned lawmakers in December 2025 that billing for other abused services had actually increased by $40 million. So while spending dropped in some areas, it climbed in others. It suggests the problem may just be shifting rather than disappearing, which is why oversight officials remain worried.
When you step back, Ethan, what's the big takeaway here?
I think it's a genuine tension with no easy answer. On one side, you have Governor Beshear's focus on accessibility, getting people into treatment fast during a deadly crisis. On the other, you have the documented reality of systemic fraud, and now a crash in available treatment beds. Kentucky went from a national leader in capacity to a cautionary tale, and lawmakers are still sorting out how to balance access with accountability.
A really complicated story with real consequences for people seeking help. Ethan, thank you for breaking it all down for us this morning.
Happy to, Grace. We'll keep following where it goes from here.
Welcome back. Our next story digs into a fight over artificial intelligence in mental health care. Kaiser Permanente is facing a formal complaint over how it screens patients. Our health reporter Chloe has been following this. Chloe, good morning. What's at the heart of this?
Good morning, Grace. So as of today, Kaiser Permanente is dealing with a complaint filed with state regulators by the National Union of Healthcare Workers, or NUHW. That union represents Kaiser's own social workers and therapists. According to reporting from CalMatters, KPBS, and the HSJ Chronicle, the union alleges Kaiser is using an automated algorithm rather than licensed clinicians to triage mental health patients. And they argue that practice actually violates state law.
An algorithm doing triage. So how exactly does that tool work?
It's what Kaiser calls an e-visit screening tool, and it was rolled out back in 2023. Here's the basic flow. A patient seeking help for anxiety or depression completes a multiple-choice questionnaire online. Then the system automatically and almost instantly generates referral pathways and care recommendations. But those recommendations might be a health education class, a self-care wellness app, or a referral to virtual therapy. They aren't necessarily a guaranteed appointment with an in-person therapist.
And the union says that crosses a legal line. What's the law they're pointing to?
Right. California law prohibits, quote, artificial intelligence algorithms or other software tools, end quote, from supplanting the professional judgment of a licensed healthcare provider. The union's core claim is that there's no evidence licensed clinicians are reviewing these patient answers in real time, or even at all, before the tool spits out its recommendation. And their logic is pretty simple. Because those recommendations arrive almost immediately after someone hits submit, union leaders say it's realistically impossible for a human clinician to have actually looked at the data first.
That timing argument is striking. What are the therapists themselves saying about the risks here?
Well, this came up at a hearing held by the San Francisco Board of Supervisors, where therapists and social workers testified in person. One of them was Ilana Marcucci-Morris, a therapist and a member of the union's bargaining committee. She told the board that algorithms just can't capture the nuance of human interaction. And she gave a really specific example. Patients suffering from depression frequently minimize their symptoms. A trained clinician is taught to catch that, but an algorithm relying only on self-reported answers might miss it entirely.
That makes sense. Did she say she's seeing real consequences from this?
She did, and this was maybe the most sobering part. Marcucci-Morris testified that the acuity and critical nature of her patients' symptoms have increased significantly. She attributes that to the new system, which she describes as a combination of the app, AI, algorithms, and unlicensed telephone operators. Her claim is that this system is incorrectly determining that high-risk patients can wait up to 10 days for an appointment. So the worry is that people in genuine crises are being told to wait far too long.
10 days is a long time in a crisis. How is Kaiser responding to all of this?
Kaiser Permanente is flatly denying the allegations. In a statement to CalMatters, spokesperson Lena Howland said the e-visit tool is, quote, an additional path to getting care, not the only path, end quote. Howland insisted the tool does not use AI to diagnose patients, to determine medical necessity, or to make clinical decisions. She said all clinical decisions stay the responsibility of licensed professionals. And she pointed out that patients can still reach a live person through a phone number provided during the e-visit process.
So Kaiser frames it as one option among many. Is there anything more from the company about how popular this tool is?
There is. A Kaiser blog post from last year describes the tool as popular, especially among younger members, and says it's available for roughly 30 different health concerns. The company also claims that patient responses are reviewed by healthcare professionals, and that members typically get a response through secure message within 4 hours. So you can see the gap here. The union says no human is realistically reviewing these in time, and Kaiser says professionals are absolutely part of the process.
And regulators are now stepping in. What are they doing?
Yes. The Department of Managed Healthcare, the DMHC, oversees health plans in California, and it has confirmed it's investigating the complaint. What makes this notable is the agency says this is the first time a union has filed this kind of grievance, specifically about the use of AI and algorithms in behavioral health care. So in a sense, this case could set a precedent for how the state handles these digital tools going forward. That's part of why it's drawing so much attention.
This isn't Kaiser's first run-in with regulators, though, is it?
Not at all. This complaint lands in the middle of a really tense stretch for the company. For starters, contract negotiations between the NUHW and Kaiser Northern California have been stalled for over a year now. And last year, the union filed a separate complaint alleging Kaiser used telephone service representatives rather than licensed clinicians to handle mental health calls. So there's a pattern the union is trying to highlight of unlicensed staff standing in for professionals.
What about actual penalties? Has the state fined them before?
They have, and the numbers are significant. Back in 2023, Kaiser agreed to pay a $50 million fine and to invest $150 million to improve its programs. That settled state findings that behavioral health patients were experiencing serious delays in care, and it followed a spike in complaints in 2021. And this goes back further. In 2014, the company was fined $4 million over long wait times between therapy appointments. So the delays issue has been a recurring theme for more than a decade.
Given all that history, where do things stand for Kaiser right now?
Kaiser is currently operating under a corrective action plan, and it has to submit quarterly progress reports to the state, so they're already under a microscope. Historically, the company has attributed these delays to a shortage of care providers, which is a real and industry-wide challenge. But critics argue that leaning on automation to manage that shortage is exactly the wrong solution, especially for vulnerable patients.
You mentioned automation more broadly. Are there other AI concerns beyond this triage tool?
Yes, and this is where it widens out. According to the reports, call center nurses have raised concerns about software and AI being used to monitor their calls, and mental health workers have objected to transcription tools being used during patient appointments. Their big issue there is transparency. They say it's unclear how that recorded data is shared or how it's ultimately used. So the worry isn't just about triage, it's about how deeply AI is being woven into every layer of care.
And the city of San Francisco is clearly paying attention. What's the local angle?
That's right. San Francisco Supervisor Cheyenne Chen is the one who called that Board of Supervisors hearing. And she did it because Kaiser serves roughly 1/3 of the city's population, so this affects a huge number of residents. Chen was pointed in her criticism, too. She labeled Kaiser's absence from that hearing, quote, unacceptable, end quote. So there's real political pressure building alongside the regulatory investigation.
So where does this go from here?
The immediate next step is the DMHC investigation, which will determine whether Kaiser's tool actually violates that state law on AI and clinical judgment. Because it's the first complaint of its kind, the outcome could shape rules for the entire industry, not just Kaiser. Meanwhile, those stalled contract talks are still hanging over everything, so the labor tension isn't going away soon. We'll be watching both the regulatory findings and whether other health systems face similar scrutiny.
Really important story to keep an eye on. Chloe, thanks so much for breaking it all down for us.
My pleasure, Grace. Thanks for having me.
Here are some other headlines. Turning our attention to the global stage, things are really heating up in Eastern Europe. Ukraine is putting the squeeze on Russia's energy sector, reporting that they hit 2 major Russian oil refineries. This strategic strike came just hours after President Volodymyr Zelensky met with Donald Trump, proving that when it comes to diplomacy and destruction, timing is everything. But that was not the only stop on the president's itinerary. On Tuesday, July 28, 2026, Zelensky arrived at the United States Capitol to rub elbows with bipartisan leaders. They were discussing the Lindsey Graham Sanctioning Russia and Iran Act of 2026, hoping to put some serious pressure on those regimes and perhaps put a freeze on their activities. Closer to home, the political temperature is boiling over in the Senate. Dr. Anthony Fauci found himself in the hot seat this past Wednesday, July 29th, after being subpoenaed by Senator Rand Paul. It was a grueling 3-hour hearing where Fauci decided to play it safe, invoking the Fifth Amendment and dodging more than 100 questions regarding his handling of the COVID-19 pandemic and its origins. Fauci claimed he was just following his attorney's lead to avoid being baited into a prosecution. However, the atmosphere turned truly toxic when Senator Paul ejected Fauci's attorney David Schertler from the room entirely. To add fuel to the fire, Senator Paul released over 1,000 pages of Fauci's personal diary before the hearing even began. Now, despite receiving a pardon from President Joe Biden in early 2025, Republicans argue that Fauci could still be in hot water for perjury committed during this specific hearing. Senator Paul has announced that the committee will vote next week on whether to hold Fauci in contempt. It seems the doctor is the one needing a cure for this legal headache. Finally, in the world of big tech, the numbers are rolling in. We are seeing the fourth quarter 2026 earnings reports for both Microsoft and Meta. While these giants continue to crunch the data, the market is watching closely to see if their profits will continue to scale new heights or if they are reaching a plateau. From the halls of Congress to the digital clouds of Silicon Valley, it has been a whirlwind of a week. We will keep you posted as these stories develop, but for now, that is the latest. Stay tuned for more as we continue to navigate the news cycle. That's all we have for now. Today's episode was made by Alexander King with Claude Opus 4.8, Gemini Pro 3.1, Gemini Flash 3, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.